Hey YouTube. My name is Jamie. How's everybody doing? This is actually my very first video on YouTube. So excited. Um, I don't know what my content's going to be about. Right now I'm just starting off with general conversations and things that are impacting me on a day-to-day. I think that's where I want to go right now with this. So that being said, um, let's talk a little bit about situations going on right now. I wanted to discuss health and what's going on with parts of our healthcare system, um, especially because it impacts me so much. I have several situations going on with my body. I have an autoimmune disease, multiple connective tissue disorder. I also have fibromyalgia. I was in a really bad car accident last year, which injured my back quite badly. Um, so I'm dealing with quite a bit of things. My major concern, though, is how our doctors are really interacting with their patients. Um, it's difficult for me. It's very difficult because I try to remember that our doctors are human, but my experiences have taught me that some of the times they just don't care. Um, I went to the emergency room in September and I was in a great deal of pain. My back was suffering very, very badly. I had tried every method I could at home, nothing was helping. I was dealing with the pain traveling all the way down. I wasn't sure what was going on with my feet. It was extremely hard for me to walk. I felt like I was walking on glass. But I went to the emergency room and I spent almost 8 hours. That's a whole shift. I didn't get paid for that shift, by the way. I spent almost 8 hours waiting in the waiting room to be seen, in pain. Okay, I was crying at this point, and I told the intake nurse that at this point, if I was going to suffer this way, I'd rather suffer at home. If they could just discharge me against medical advice, and that would be the end of it. If I was going to suffer, I'd rather do it in my own bed. And within 5-10 minutes, I was seen. That's ridiculous. First of all, absolutely ridiculous. I shouldn't have to threaten to leave in order to be seen. Secondly, when I got into the room and the doctor finally came in, the first thing out his mouth was, I don't mean to offend you and I don't mean to be insensitive, but what is it that you expect me to do for you? That's a hard one because you're the one with a medical degree and you're the one that's supposed to know what to do, or at the very least, pretend to know what you're supposed to do. I don't have medical training, anything resembling medical training. I think, I went to school. I was attempting to do nursing before my accident. My knowledge is just based off of what I got from school before the accident and what I continue to learn on my own. But I do know that a cursory exam is one of the first things that you do. You don't go into a room and insult a patient by saying, what is it that you want me to do for you? You're the doctor. Examine me. Manage my pain because I'm seriously feeling like I'm dying from it. I don't understand. I don't understand where this breakdown is happening. Okay? if that is the ER experience, why do we have emergency rooms? For doctors to tell us that they don't know what they can do for us? What is the point of that? What is the point of that? I was so disappointed. So disappointed in the care, the level of care that I received. And I'm not going to give names as to the hospital or anything like that, because this is not something that happens in just one place. It happens in many places, and it needs to change, because the doctors aren't suffering the consequences. The patients are. I'm suffering because my doctor didn't know what to do, and that's a shame. How do we help? How do we make it better? We can't fix the problem if we don't communicate. And if doctors have to go in for more freaking training, then go in for more freaking training. But you should never, as a medical professional, ever approach a patient and tell them, hey, I don't know what I can do for you, without even examining them first. Like, that's common sense, don't you think? I don't know. Dr. Mike, what do you think? I like your show. I think you're a good doctor, But again, it's hard because I have health issues that I need to get addressed, and those doctors, those kinds of doctors, don't give me confidence. I don't feel safe going to the doctor sometimes, and that says a lot. I don't know. What do you guys think? Anybody else had these kinds of experiences? Leave a comment. Let me know. Thanks for listening. Again, like I said, I don't know what this is all going to be about. I just, I want to get my toesies wet in the YouTube world. See how it goes. All right, guys. Catch you later.